How does activity analysis guide occupational therapy interventions? Imagine trying to put together a puzzle without knowing what the picture is. That's similar to how occupational therapists understand what a person needs after surviving cancer. They look closely at what a person does every day, how they do it, and what makes those tasks easier or harder. This process is called activity analysis. It's like a detailed map that guides the whole therapy journey. When working with someone who has survived cancer, the therapist starts by asking which daily activities matter most. It could be dressing, cooking, cleaning, or even returning to work. The therapist then observes or discusses how the person performs these tasks. They pay attention to physical issues like weakness or pain, cognitive challenges like memory problems, and emotional factors such as motivation or frustration. For example, a person might tire quickly when standing to cook or forget steps in a familiar routine. With this information, the therapist can identify specific challenges. They then develop tailored plans to help. This might mean teaching new ways to do a task, like sitting on a stool while cooking to save energy. Or it could involve suggesting tools, like grab bars or adaptive utensils, to make activities safer and easier. If fatigue is a problem, the therapist might recommend breaking tasks into smaller parts with rest breaks in between. Activity analysis also helps set clear goals. Instead of vague aims like get better, goals become specific, such as be able to dress independently or return to gardening. Progress is measured by whether the person can do these activities more easily over time. This makes therapy focused and meaningful because it connects directly to what the person wants to do in their daily life. For cancer survivors, this approach is especially helpful because their abilities can change from day to day. Some days they might feel stronger, others more tired. Activity analysis allows the therapist to adjust the plan as needed, ensuring support stays relevant. For example, if a person struggles with energy, the therapist might suggest energy-saving techniques like pacing activities or organizing supplies for easier access. In practice, a therapist might visit a survivor's home to see how they move around or use their space. They might recommend rearranging furniture to prevent falls or teach ways to conserve energy. If returning to work is a goal, they analyze the specific tasks involved and practice those skills or suggest workplace modifications. This could mean adjusting work hours, providing ergonomic equipment, or practicing specific job tasks. Activity analysis is not just about physical skills. It also considers how cancer and its treatment affect mood, motivation, and social life. If someone feels too tired or down to see friends, the therapist can help plan shorter visits or suggest virtual chats. This way, emotional well-being and social connections are part of the recovery process. Overall, activity analysis helps occupational therapists understand the real-life impact of cancer survival. It guides every step of therapy, from figuring out what needs help to setting goals and choosing the best interventions. This approach makes support practical, personal, and directly connected to everyday life after cancer. It helps survivors regain independence, participate in activities they love, and improve their overall quality of life.